What doctor shall I?
It's like for kashayams and all.
Just a second. Aushadha Kala means I didn't get actually.
Ma'am, any specific timings for prescribing medicines? Like generally in kashayas we give before food and
Yes,
ghrtas
yes, yes.
usually after food.
Hmm.
Is there any other specificity that you would like to tell?
No, no. Actually, I also prescribe the patient like the kashaya 10 to 15 minutes prior to food. And if I'm giving gruda, like especially like this 1 to 2 hour before food. And if abhayarishtam, when I am giving abhayarishtam, sometimes if there is a severe pain and discomfort, if abhana vaigunyam is more, sometimes I advise the patient to take prior to food.
Okay.
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 Rakbaktam usually I advise only in that condition.
Okay. Ma'am, can you please explain about the vitamin D deficiency causing fibroids?
Vitamin D deficiency, it's very much now common nowadays, especially in the this lockdown period and all. So sometimes the patient may complain with you like heavy hair fall, like even with a small like what like bone pain. If they are like small like what kind of ചെറുതായി തട്ട് മുട്ടൊക്കെ ചെയ്യുമ്പോഴത്തേ ഭയങ്കര pain പറയും. I
Yes.
don't know how to tell translate it in this.
In small
So
movements also there will be more pain.
there will be more pain. So such type of frustration will be there. And always try to check if there is fibroid is there, and this vitamin D is also having a very good effect to maintain fertility. So if you're looking for the patient is looking for fertility or pregnancy, then check vitamin D. If the vitamin D level is low, do the supplementation. It will support the fertility. And nowadays studies are saying that vitamin D cause fibroid, vitamin D deficiency cause this reduce the ovarian quality, especially follicle quality, or they will contribute to low AMH and all. So please check AMH against vitamin D level in such patients.
Okay, ma'am. Ma'am, in young girls also we see chocolates is nowadays. So is there any
Mm.
specific treatment for the young and unmarried girls?
Yes, usually chocolates is like 3 to 4 centimeter. It will disappear within a period of 3 to 4 months of treatment. You can usually, I got result with this Mahatiktagam Kashayam Kandasinpuram combination and this Trayantiadi Kashayam, Gobi Jandaradi Guliya, this Gukulu Panchabalam tablet. I got result with this. It just usually disappear. Like even if it is 4 centimeters, and one perimenopausal lady I'm having, she's having a large, cyst, like 6 centimeters. Cyst. Now it is reduced to like a 1 centimeter. Cyst. So our medicine are is having action on that. Like more like Pitta Vada Shamana line of treatment is having a good result.
Okay. Okay. Ma'am, in Pitta Prakriti patient, which kashayam we should use for dysmenorrhea? As you told, we have to use Ushna Kalpas.
Krishna help us.
Uh,
Like if it is more like there is more inflammation, especially in endometriosis type of like if there is more inflammation is there, if due to that inflammation the pain is there, then we can give like pitta shamana. We can include pitta shamana line of treatment, or we can place a vada pitta shamana line of management also to reduce that. Even with this Narkundiadi, Hulujiadi, all are having this Punarnavadi Kashayam, it will reduce the inflammation. Then we can go for this Gandharvastadi with this Shirabalavarti and having very good effect in reducing the pain. Or even we can give like this Mahanarayana Thailam internally, we can give like 5 ml internally. It will also reduce the pain. Or even we can give Vasti with Mahanarayana Thailam, or even with Danatran Thailam. It also will having effect. First, reduce the inflammation and all, then go for this Vada Shamana line of treatment. Then it will be more effective.
okay. Ma'am, how to treat a 40 years old lady having micturition while sneezing?
Micturition while singing. That maybe there may be a increased risk of cystocele will be there. So advise the patient to do a Kegels exercise, and we can give this Gandharva Stadi Kashayam with the steerable. I tried it in a patient with the cervical incompetence also. It is having a very good effect on the this lower genital system, especially the pelvic floor. And also we can give some pichu dharana. Pichu dharana, even with plain tilatailam. One of my senior has done a PG work on that with plain tilatailam. Cystosil, she had done pichu. It is having the patient will get more symptomatic relief will be that. Or you can also keep the another baby. If there is no infection, first make sure there is no infection. If there is any discharge or do first treatment for that, then go for the pichu dharana.
Okay, ma'am. Ma'am, Matra Basti alternate day or daily we have to give for dysmenorrhea condition.
If the patient is like patient is available all day, we can opt for like daily we can give like matravasti 60 ml. We can give minimum 60 ml. So
Okay.
if the patient is available alternate days, that's okay.
Okay, ma'am. Is there to be done like Snehana Swedana as normal we have to do for the Matra Basti?
No, if it is a small dose, there is no need for snehara svedana and all. We can do it like we can directly do the matravasti.
Ma'am, next question it's
But
regarding
one, first make sure her acne is correct. That
oh,
also we had to make sure.
okay, okay. Ma'am, next question is regarding the infertility. Ma'am, infertility with normal female 28 and male 31 with 50% motile sperm count and
Mm,
teratozoospermia with
mm,
94% head defect,
mm.
2% normal morphological sperm. What should be advised for this?
Female is normal. Male is having a low sperm count. Testosterone 94% head defect. Okay, that normally we should there should be more than 4% sperm should be normal. Then pregnancy is possible. 2% with normal morphology. Okay. So first we had to correct the acne. The Chiruvilvadi Kashayam we can give. Kalyana Gulam. I had similar case like this. So I gave that patient the Chiruvilvadi Kashayam. Kalyana Gulam I had given. Then I had given this Adisova or like the sperm got like for I think Spearman for Himalaya is there. Then after that we can give this Maharasnadi Kashayam. After giving this Kalyana Gulam, Chiruvilvadi Kashayam, etc. for 1 month, after that give some Rasayana type of medicine like Maharasnadi Kashayam, etc. is having very good to correct this oligospermia and all. And also check the patient is having like cholesterol and all. So it will affect the mortality and all. So correct that also.
Okay, ma'am. Ma'am, in PCOD case, we see acanthosis. For that hyperpigmentation, can you suggest any kashaya or lepa?
So acanthus nigricans we had mentioned now it is about the in because of the insulin resistance only. So we had to correct the insulin resistance. We had to give internally medication like the Nisha Kadakadi, Muhamanchastadi Kashayam, etc. We can give internally. Along with the internal medication only externally we can give this Lodradi Churnam or Eshtimadu Churnam has a minimal effect. But with internal medication, if you are giving that, it will have a very good effect.
Okay, ma'am. Ma'am, you had explained about that vaginal dryness
Hmm.
due to the low estrogen level. So, is there
Hmm.
any applications that we can do?
Yeah, you can do Danundaram Biju or Shadadauda Gratham also. Also, you can give. If there is burning sensation and all, Shadadauda Gratham is having very good effect. And also this Danundaram Biju or even with the Bella Guluja Thailam also can externally apply.
Okay. Uh,
With internally, if we are giving this Shadavari type of Shadavari Kulam or Shadavari Gratham, it will support the proper estrogen, like phytoestrogen action is there, no? So it will have support the less mild lubrication.
okay. Ma'am, what is your suggestion about the menstrual cup? Is it good or what is your go on that?
Actually, I don't suggest menstrual cup and all because in our concept there is no abana, normal abana vayu should be flown, no. So there is some obstruction, no. Like that, if I'm thinking, I feel that it is not good. By later, like within 10 or 12 years later, we will see then only we can see like the complications related to that only. And also, if the vaginal mucosa is very much sensitive, if you are keeping the cup, it may cause local irritation also by like a prolonged use. That also one thing I am worried about. I don't know actually.
Okay, ma'am. Ma'am,
But
for
nowadays, more people are supporting menstrual cup also. But these are my concerns.
yes, yes. Okay, ma'am. Ma'am, for Nabothian cyst, what treatment can we suggest?
So Nabatean cyst means it's actually the where the cervix is in the healing process. So we can give like medicines to like Shara preparation, or even the Tanganak Shara is having very good local application of Tanganak Shara is having good effect, and also even like Tribala Kashayam with Tuttam is also having good effect. And internally you can give like Tribala Gokulu, Chandraprabha tablet, or even the Rudyadi Kashayam is also having very good effect.
Okay, ma'am. Ma'am, for vaginal discharge, you had told Kankayana Gutika.
Yes,
So,
yes.
can you please explain how Kankayana Gutika is used?
Like Angayana tablet with Chirvilvadi Kashayam is having like effect in like Stravam. It's mentioned in Arshas, no? So here also we can give this medicine. I usually give this Chandraprabha and all. Some my seniors are following this Kangayanam tablet for this vaginal discharge, so I included this. But I usually give Tribala and also in
Okay, ma'am.
varicocele and all. This Kangayana tablet with Chirvilvadi Kashayam is having very good effect.
Okay. Ma'am, another case, 28 years old female patient post marriage had severe itching and white discharge, ruled out diabetes mellitus for husband and wife. Itching and discharge was managed by allopathy by itraconazole, but recurring in nature. Husband also gets balanitis post intercourse. Vaginal smear taken and found vaginal candidiasis. Vitamin B12 D deficiency present for both the couples. Supplements taken. Female patient used to have constipation and hard stools previously during initial days, now better. How to manage such recurrent cases of vaginal candidiasis?
So is the lady diabetic mellitus?
Yes.
So why does that? Yes, yes. So you had to control the diabetes mellitus, then give like Kabashamana type of like Ayurveda type of medicines you had to give, and like Tribala Kashayam Shalan for both the couples, especially for the male, and also you had to advise the Tribala Kashayam to wash the genitalia, and for before like for during the course of treatment advise the patient to use like this barrier contraception and all. So after the correcting the infection, do a rasayana type of treatment in order to prevent the recurrence. Okay, that also we are like usually we give medicines to for controlling the symptom, then we will stop medicine, then it will recur. So rasayana is also having an action. So and also advise the patient to reduce the carb, sugar and such type of, because this candidal infections survive more in acidic medium. So that also we had to keep in mind.
Okay, ma'am. Ma'am, is there any Ayurvedic medicine for withdrawal and ovulation and induction? Withdrawal, ovulation, and induction.
Withdrawal and withdrawal means
I think withdrawal bleeding, I guess, ma'am.
withdrawal
Ovulation,
ovulation
induction.
ovulation induction. So in a PCOS type of patient, if the follicle is not there, we can use the Kanashada or the Kashayam, which will support the proper development of follicle, and even some Leshuna tablet with Tilatailam and little bit of like Hingu is having supporting the proper development of follicle. And when the follicles start to grow, and if it is not rupturing, I had already mentioned like Jiragaristam is having, Sukumara Eranda is having effect on to rupture the follicle. So these are the common methods which I try in my practice.
Okay. Ma'am, another case. Ma'am, patient aged 40 years with breast fibroadenoma. Operated for the same twice at the age of 18 and 20 years. Again, after marriage at the age of 35, again she developed fibroadenoma, both breast. Taken Kanchanara Gugulu, Varanadi Kashaya, but no relief. Developed fibroid 17 into 17 mm and 20 into 21 at the age of 40. So, what can we do in this case, sir?
So one case of fibroadenoma I gave this Dhananta Dayanadi Kashaya with Kanjanara Gugula. I got a relief. The patient is having severe pain on this fibroadenoma, especially around the time of menstruation, and the size was also reduced. So this is a one experience I had. this Triandiadi, I also give Triandiadi in between. Then I think this Dandanayana definitely I had given. Dandanayana Kanchanaram is having good effect. And I had also give this Shadharana tablet, and I also advise the patient to take vitamin E supplementation. That also I had advised.
Okay, ma'am. Ma'am, we have two of our participants waiting to talk to you. I'll just connect. Dr. Neha, you can speak.
Yes, ma'am. Thank you. Ma'am, I have a patient, 1.5 months pregnant lady.
Hi, Dr. Neha. Your voice is
Please,
not clear, doctor.
hello.
Neha, your voice is not clear.
Yes, ma'am.
Yes, now it is clear.
Ma'am, now clear.
Hello? No, 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 it's not clear.
Yes, ma'am. A patient,
Neha, can you please check your internet?
ma'am. Yeah, ma'am. Now clear, ma'am.
Okay,
Yes,
speak.
yes.
Ma'am, a patient. Uh,
Hmm.
I have a patient, 1.5 month pregnant.
Hmm.
In her USG report shows subserous fibroid
Hmm.
situated at posterior part of fundus. She is also suffering from psoriasis. How
Hmm.
can treat this patient? Please explain.
Subserous fibroid, is it causing any other difficulty? How much is size? The size of fibroid?
Uh, Ma'am, 6 centimeter.
6 centimeter, 1.5 months
6
pregnant.
centimeter.
6 centimeter.
Yes,
Nowadays, we
ma'am.
can't, during the pregnancy period, we can't give medicine like Abashamana type of medicine because she is pregnant, no? So that is also one thing we are facing. And
Yeah.
we can also advise the patient to have a diet restriction. That is like Mamsaharam phytoestrogenic diet, we can advise the patient to avoid. And also like Nayopayam Kashayam, we can advise the patient. Nayopayam Kashayam is also having the effect on this condition. And the psoriasis, actually, I don't know, truly speaking. I had not like dealt pregnancy and psoriasis. So that I can't comment, doctors. I'm so sorry. But this, you can try this. And there is an first 3 months advise the patient to take proper rest because the fibroid size is much high and there is an increased risk of bleeding or abortion is there. So advise the patient to take proper rest and also you can give medicine
Yeah,
like
ma'am.
Garbhasthabana
Uh,
drugs like Balasarpas you can give or even like Profert type of
Ma'am,
tablet. Atrifem all we have you
ma'am,
can try. Yes, doctor.
uh, can I give Garbhapal Ras?
Garbhapal Ras in the psoriatic and Garbhapala is usually given for this vomiting and all those pregnancy related symptoms, no? In this case, she is not having that much issues, no? So is it a best option?
Yeah. Uh, Ma'am, anything else for medicine?
I think Niobime is
Ma'am,
a
any other
very good option,
option?
doctor. This Danundaram Kashayam is also a very good option. Danundaram Kashayam. Niobime Kashayam. Both are having a very good effect, I think so.
Okay, ma'am. Ma'am, any complications in further?
Yeah, complication maybe in there is an increased risk of abortion risk is there because it's submucous, no? And there's an increased risk of abortion is one complication, and there may be an early
Sub-serous, ma'am, sub-serous, not
subserous,
submucous.
not sub. Okay,
Ma'am,
okay, okay. Okay, then there will
sub-serous.
not issue. Okay, then there is no issue regarding that. It is subserous, no? Then there is no issue. If it is submucous, there will be an increased risk of abortion. Subserous, no, definitely no issue. Don't worry about that.
Yeah, ma'am. Okay, ma'am.
Okay.
Okay, ma'am. Thank you very much.
Thank you.
Okay, doctor. Thank you for your question.
Ma'am, next question. If family history of PCOS, how early can we do the screening for PCOS after menarche?
So even after menarche in the early stages also there will be some PCOS type of pattern will be sent even if it is ultrasonographically. So like we can't like completely believe in that USG. So in the initial phase also like we had to prevent the occurrence of the PCOS. That is the one thing we had to do. And there is the subject is all like in a higher risk of developing PCOS. So if she is following proper diet and lifestyle, then there is a less chance of developing PCOS.
Okay, ma'am. Ma'am, we have another participant. Uh, Ujjwala, you can speak.
Hello,
Hi, Dr.
good evening,
Ujjala.
ma'am. Good evening, ma'am.
Good evening, doctor.
Such a nice explanation. Thank you so much, ma'am. You have
Thank you,
covered a
doctor.
lot of topics. Ma'am, I have asked that question, ma'am. That 40 years lady with fibroadenoma and fibroids.
Yes, 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 yes,
No,
yes.
that patient is that Hetu is not Santarpanjanna, all
Mm,
Apatarpanjanna, like
mm,
stress, more is stress and
mm,
like Jagran and again
mm,
Anashan like was
mm,
the Hetu. So like this
mm,
patient, if we give Lekhana, we have to give
mm,
Lekhana treatment also now to
mm,
reduce that
mm.
fibroid size and
Yes, yes,
fibroadenoma.
yes.
So how
Mm,
to deal with, and like that also PCOD, lean PCOD also we have to face the same we will face the problem to give treatment because their hetu is vata prakopak.
mm.
So how to deal with such a condition if patient is having vata prakopak hetu and pitta prakruti, so how to use lekhana and ushna aushadhi, how, or we have to give tarpan like bruhan chikitsa in this case, that I am confused.
Okay, doctor. In this case, like in the fibroadenoma case, usually that's like kabasthana, no. So we can, but without like vitiation of the vata. So side by side, you can give like Gandharvastadi and all in order to prevent the vata tushti. So here we had to opt for Legana. That is one thing we for sure. And next thing is about the fibroid, right?
Yes, with
Fibroadenoma and one more thing you had asked. One
fibroids and like same lean
lean
PCOD.
PCOS. Yeah, in the lean PCOS also there is like Abhadarpan doctor had mentioned that it's because it is like genetic factor only. So there is definitely like a insulin resistance is there. So there is like we had to like do the treatment to correct the vata. That is also one thing for sure. And we had to start the treatment from the like the insulin resistance itself. That also we had to keep in mind. So in that condition also, by passage of time, if we are not treating the condition lean PCOS, if we are not treating it properly, it may lead to obese PCOS. That will, by passage of time, it will lead to obese PCOS. So in that case also, we had to do mild Abhadarpana without vitiating the Vada. That also we had to keep in
Yes, ma'am. That's I'm confused. How to do this
mind.
apatarpana with like you are telling, how which medicines we should use in this patient. So lekhana will be there and vata prakopa should not be there because if tikta rasa also will aggravate the vata, and again
Mm,
if we katu rasa also we will use like kanchan or gudgul, all that also will
mm.
aggravate the vata. So which kalpa we should use along with that? That is my question.
So in this case, we can also Tiktarasa, like this Padoladi, Nimbadi type of Tiktarasa Pradhana Aushadha is having more effect than this Kanjanara type of Kabahara, Kaba Medohara. This Kanjanara is having more Kaba Medohara property, no? So Tiktarasa is having more effect, which we are like if we are looking though in the dosha basis also we can see it is having action on to reduce the excess this like of dushti. And also we can see that in the modern aspect also we can see this is having an action on the liver and this pancreas also. And also, if we are like in Ayurvedic concepts, if we are looking also, this Tikta Rasa will definitely alleviate this Vada without increasing the Kapha and all.
Okay, ma'am.
So Tikta Rasa Pradhana Dravyas is having best result in lean PCOS.
Okay, ma'am. Thank you so much.
Especially like Padoladi, Padola Kadurokniati, like that type of medicines.
Oh, okay, ma'am. Thank you so much.
Okay, doctor.
Ma'am, next question. Ma'am, what treatment can be given for bilateral breast pain and tenderness, which is physiological?
Especially related to menstruation,
Yes.
bilateral, but so definitely we can offer like Purarnavadi, Kashayam, Shaddaranam type of tablet, or even Sudarshana type of medicines which we are giving like prior to menstruation. It is having effect in, to reducing this breast related pain.
Oh. Ma'am, patient presenting with endometriosis and low AMH with secondary infertility, what should be the
Mm.
treatment? Will it be for endometriosis or infertility?
So usually endometriosis patients are having this low AMH level. It may be one reason, maybe that if the because of this endometriosis, the normal ovarian function may not be happening. Even if the patient is having a good ovarian reserve, the AMH level will be shown low because the ovarian activity is hampered. So our treatment aim line should be to reduce the endometriosis. So even if we are giving medicine to reduce the endometriosis, definitely it will if she is having a good follicular reserve, definitely the AMH will improve.
Okay. Ma'am, which type of yoni pichu or yoni varti do you suggest in case of severe vaginal candidiasis?
In severe candidiasis, I usually like if we are opting for Varti, Pipilyadi Varti is having very good effect. Usually candidiasis I use like kashayam, like more like Tribala kashayam with tuttam or Arakvadadi kashayam, such type of medicine like Rukshana, Kledahara type of medicine is having very good effect. Then after that only go for Varti and all. And
Oh,
Pichu is not having that much good effect because it is more Kledam, like it support the Kledam, no? So initially Rukshana type of medicine is having good effect.
okay. Now we have another participant, Dr. Jyoti. You can speak. Hello, Jyoti. You can speak.
Yes, ma'am. What can we think about mid-menstrual spotting in Ayurveda?
Hi, hi, Dr. Jyoti.
Yes, ma'am.
It can be either due to like ovulation. Some patients due to ovulation they are having like mid-menstrual spotting is there. Is it
Yes,
due to that?
yes, ma'am. And some of them are having fibroids also.
Mm.
And some young girls are also having PCOS, and again they are having mid-menstrual spotting.
Mm. With PCOS, I usually see PCOS patient have this mid-menstrual spotting because if the especially in the ovulatory cycle only they are having this type of mid-menstrual spotting. Otherwise, in non-ovulatory cycle they don't have. So
Okay.
in that case, also in this that cycle we can give like this Musali Gadradi Pushyanagam in order to, for 1 or 2 cycles, then it will gradually subside.
Okay. Okay. Thank you, ma'am.
Okay,
Ma'am,
doctor.
one another question. Can I ask, ma'am?
Yeah, sure, doctor.
Thanks, ma'am. Ma'am, for increasing the estrogen level,
Mhm.
what should we think in Ayurveda?
Like Sugumaram Kashayam, Sugumaram Ghrutam is having more phytoestrogenic activity, and Shadavari is also having more like phytoestrogenic activity. If we can give it in cases like if, this, especially in cases where like not in PCOS type of patient. In PCOS, if you are planning to give this Sugumaram Ghrutam in order to support the follicular activity, you had to give some Tikshna Ushna Aushadhas along with it, like Pipalya, the Anuvasana Thailam, you can give mixed with Sukumara Kritam, you can give it internally. It will support the proper estrogenic activity. It will reduce the FSH and all. Usually you can try this also.
Okay, ma'am. Thank you, ma'am.
Okay. Ma'am, next question. How to treat excessive bleeding for more than 15 days and severe weakness?
Severe weakness first, if there is heavy bleeding, first check the HP level. HP level, if it is less than 10 or less than 8, then it's better to refer the patient. If it is because we need some like iron supplementation should be there. So otherwise we can manage like a strong like pitta shamana line of treatment we can give. Or even we can also, if it is long, no prolonged bleeding, no, then we can opt for Tengambukaladi lehyam also. Or even this Musalikadadi, Kulujiadi, Tiktagam, Drakshadi Kashamas, Muhur, we can give, or even Vashaswarasam. So anyway, we had to use the Stambhana Aushadha because the patient is also, and also we had to advise some Pravala Basma. Some calcium supplementation is also need to be added to this medicine.
Okay. Ma'am, what can we do in recurrent UTI conditions?
Recurrent UTI, it's better to give Brihatyadi, Chandraprabha, Ulujiadi. I usually give Needi Kashaya tablet. Needi tablet, not Kashaya tablet. Needi tablet is having very good effect. Chandraprabha DS we can give. So it will prevent the recurrence and also advise the patient to like drink like Gurujiadi as toyam for 1 month continuously. It will definitely prevent the recurrence.
Okay, ma'am. Ma'am, in genital herpes, how to treat?
Actually, doctor, I had not experienced a genital herpes case. I had not dealt with it, so I'm so sorry.
Okay, ma'am. Ma'am, please explain the treatment for oligohydramnios in third trimester.
Oligohydramnios. I think Dr. Asmabi will comment on that.
Okay.
Anyway, I will this Kushmanda Pasayanam, it is having very good effect.
Okay.
This brinjal, no, lady's finger soup is having very good effect.
Okay.
That all you can try.
Ma'am, what precautions should be advised to patients for Pichu Dharana?
First, we had to like the sterile the gauze. If you are like advising the patient to take Piju at home, you just give like sterile like Piju ball for 7 days and advise the patient to wash the hand properly and make sure that before that there is no infection. Then only advise the patient to do Pijadharana and advise the patient to hold the Piju for like Amutra Galdaha before applying Piju, ask the patient to evacuate the bladder, empty the bladder, then uh, like make the oil, either the Danundaram or which oil is sufficient, which oil is like up to that condition. Warm the oil, dip the Piju ball, and advise the patient to insert it. When like in a squatting position, it will be easier for them to insert itself. So, like the piju, like the thread should be somewhat more length than we usually. When we are doing the thread, the length will be, if it is a narrow also, it will be okay. But if we are giving the patient to home, then the thread length should be long and advise the patient to, in a squatting position, insert it gradually. And like with one finger, she had to deeply insert it and advise the patient to rest for 1.5 hour with leg cross. That also we had to advise the patient with leg cross. And after that, even again in the squatting position, she had to gradually pull it, or if she feel it dry, then externally apply some more oil or gruta. Then gradually she can easily remove it. Okay, 1 or 2 times we had to teach the patient when we advise the patient to come to a clinic, do it so, and then at home they can do.
Okay, ma'am. Ma'am, one of our participants wish to speak to you. Yes, doctor.
Ma'am, good evening. It was a
Good evening,
wonderful
doctor.
session, ma'am.
Thank you, doctor.
Ma'am, actually, one patient is there, aged about
Mm,
60 years.
mm,
So she complains of bleeding per vaginum. After
mm,
the investigation, it was confirmed that CA cervix is there.
mm,
So what is the line of treatment for CA cervix, ma'am? But she don't have any hetus, ma'am.
mm,
I have taken all the history, but there is no particular
mm,
hetu.
mm. So CA cervix is confirmed, no? So hysterectomy will be the first line of treatment we had to advise the patient, no? So if it is still if it is not removed, then there will be increased risk of secondaries. So advise the patient to do hysterectomy.
Okay, ma'am. Uh, uh, Later,
Okay.
ma'am, can we give any treatment to prevent further
Doctor, actually, I'm not that much practicing malignancy in my practice.
Okay, ma'am. Thank you.
Okay, doctor.
Okay, ma'am. Just two more questions, ma'am. Ma'am, can you please explain the role of Uttarabasti in infertility?
So Uttaravasti we can practice if we after doing the Shodhana, then doing the Vasti, then only go for an Uttaravasti. So depending upon the condition, we can opt for medicine. Like if the patient is having the endometrial receptivity is less, we can opt for like Sukumara Kritam we can keep. Like if we are planning to do an Uttaravasti, first when we are doing the Vasti time, at that time do a survey examination per vaginal examination. If the infection is there, remove the infection, give medicine to remove the infection, then only go for an Uttaravasti. If there is any infection is there, please don't go for an Uttaravasti. We are like again spreading the infection inside the cavity. And also first thing we had to make sure like 5 ml is more like in a safer side. If you are taking oil, 5 ml is safer side. With even with it will, I think with an IUI cannula you can easily available, no? With IUI cannula you can easily do the Uttaravasti. Like 5 ml you can take, you can insert it into the deeply, because the IUI cannula is very narrow. It will be easily go through the cervical wound. And then you can when it should be reached like this much length, it should be inserted inside, and then you can give the medicine slowly. So it will improve the like the endometrial receptivity. So you can opt for 2 to 3 days. Or if you are planning to give medicine to if the like the tubal, if there is any tubal issues is there, like Kedaki, Mula, Thailam, etc., has having very good effect to remove the tubal cause. Okay.
Okay, ma'am. One last question. With that, we'll end the session. Ma'am,
Okay.
patient complaint of PV bleeding after
Mm,
9 years of menopause.
mm.
On
So
examination,
definitely, mm,
sorry, ma'am.
if
On
mm,
examination, no major findings.
mm,
USG is normal. So
mm.
she's asking whether we should screen for CA.
Yes, definitely we should screen, because with we should not like take risk. If the menopausal bleeding is there, usually in the perimenopausal period, the endometrial thickness should be much less, like it will be about 2 to 3 millimeter only. But if there is spotting, or we should rule out the endometrial CA first. So usually cervical cause may be there, or even endometrial cause. But if the spotting is there, just go for a USG, or even you can take endometrial biopsy should be there. You advise the patient to do a DNC and do an endometrial biopsy. Then if the cause is okay, then only like it's first thing that 90% we had to exclude the malignancy. And also advise the patient to cut down phytoestrogenic diet. If the patient is obese, also there will be phytoestrogenic cause or the peripheral conversion, which may be a cause for like increasing the endometrial thickness. First thing, we had to exclude endometrial CA.
Okay, ma'am. So that's the end of questions. So thank you so much for patiently answering each and every question.
Thank you.
Thank you so much, ma'am. So
Thank you, dear participants, for your patient listening. And thank you, Dr. Radhika, for supporting. And thank you, Dr. Jasul, for giving me this wonderful opportunity.
thank
And
you, ma'am.
all the best, dear doctors.
Thank you, ma'am. Now I have a request to the